Hi, my name is Celia and I'm doing the thermal lipo. I have 4 kids, and before I had my kids I feel great, but now I just don't feel good, and I would like to, with this procedure, be able to look better and feel better. I really feel like I don't want to use any tight clothes. Everything has to be loose, and I'm still young, and I really want to look great. I mean, better, feel better. Dr. Nowak, he's been treating my veins for the past 3 years, so that's how I get to know that he's been doing this treatment, and I really feel comfortable with him because, like I said, he's been doing a great job with my veins. I don't like what I see right now in my body. That's why I'm doing the thermal lipo.
So we're marking the areas, and we want to mark in a standing area because this is how most people are. When you're laying down during the procedure, things will look a little bit different. Also, there'll be some numbing medicine that won't allow us to see the contour differences as precisely. So the markings are very important to see where we want to make our contour or our transitions, where we want to blend into the hip and the upper buttock area here, where we want to come up into the little bra fold to be able to work across those areas. What are the areas that you see that concern you the most?
Right here, in this area right here, also in the front.
We judge it by how much we can pinch. So what we can pinch here is what we can help you. So this is definitely where we're going to be able to help you a great deal. We're going to bring out, you can feel where the muscle and bone structure is. That's where we're going to bring out the shape that you have hiding underneath here. Definitely we'll get up into these areas to get more shape and contour. The goal is to take more from here. So we're trying to make as much of a transition, as much of a difference between the waistline. We'll try to get enough from here to make you happy, but the goal is to make that smaller there.
That sounds great.
The laser is actually heating and melting the fat in those areas. Right now we're doing the laser lipo. So this is also known as smart lipo. And the laser is the little light that we see underneath the skin, and that's gently heating the little fat cells. And it's helping to break down and melt the little fat cells for us, making it easier to remove them. The laser also can heat the skin a little bit to help tighten it, although thermage is what's really going to do the most to help tighten the skin and tighten these stretch marks after the procedure. So you can see it just goes very gently under the skin. There's very little or no trauma to the area.
I feel fine. I don't feel any pain, or I don't feel nothing.
We're doing the power-assisted liposculpture. So this little instrument, the little cannula, is like a little straw that reaches underneath the skin, and it removes just a small little fat deposit at a time. The beauty of the procedure, this is local anesthesia. Our patient is here, awake and alert with us, and just very gently, it's like using an electric toothbrush. It gently removes the little fat deposits. We've already used the laser to help break up some of those areas, and we can see that we have the nice little fat cells coming out there. These fat cells are permanently removed, so they will not grow back. We don't grow new fat cells at this stage of our life, so if our patient maintains her weight and keeps everything stable, she's going to do great and have a wonderful long-term result.
I mean, right now you don't feel absolutely nothing. It's just, like I said, it's just like a massage. I'm ready to leave, and we'll see the result. Oh, it has been 3 weeks since the thermal lipo, and the results has been great. I feel good, I feel skinnier, and I can fit in all my clothes the way I want it to look, and I just feel great. The next day, I feel good. I went for a walk to the mall. The very next day, you can see the difference.